It is Monday, April 6th. I'm Joe Delarone, and welcome to the Kahnawake COVID-19 Task Force Daily Update. Today we have some announcements from both the Peacekeepers and the Kahnawake Fire Brigade, as well as some updates from Lisa Westaway and Lloyd Phillips, as is our usual on these updates. As we get going with the week, we passed the weekend unscathed, but we do have some announcements to make, some of them of a serious nature, and we'll get started with Kahnawake Fire Brigade Fire Chief David Scott.
Thank you, Joseph, for that introduction. First of all, I have two points to make for you. And the first one is regarding ambulance. Effective today, immediately, any ambulance call that comes in, no matter what the nature of the call, the paramedics have been instructed to wear proper a gown, gloves, and a face mask, and also the mask on the mouth. So do not be alarmed when they respond to your house for any call that comes in from now on. This is for their protection, and it's also for your protection, and we can stop possibly the spread of this virus. That's effective immediately. The second thing I want to talk to you about is there is now in effect in Kahnawake a total fire ban. In the region, the danger is high right now. I understand that the weather is nice and people need to get out into their yards and they want to clean and they like to burn, but like I said a couple of days ago, burning your grass, it doesn't make it green, doesn't help it along. Bonfires are just going to make people gravitate together and gather around a bonfire. We don't want that. We want social distancing. The biggest thing I want to talk about too, possibly coming up, is bullhead fishing season. Should be starting soon, I think. Don't burn. Do not make bonfires. Do not make any kind of fire. Leave it as it is. I need to make sure that my guys and girls at the fire station are protected as much as possible so they are ready for ambulance by having them respond to needless calls, potentially putting them in an infection way. Then there's after the call, all this equipment has to be cleaned and disinfected thoroughly, top to bottom, and that includes the trucks and that includes the equipment. So please, no gathering for bonfires, don't burn your grass, and no burning on the bullhead when the bullhead season starts. Nyawa, dano what's us kogo.
Right, now, Dave, and also we should mention that the fire ban also extends to Joworodu. Same rules apply. Also, if you are caught, you could be fined, and both the Peacekeepers and the Kahnawake Fire Brigade firefighters can issue fines, and they're not the usual smaller fines that happen during regular times. We are in, of course, the pandemic, and we have different rules applying, and the fines will be going up. So just don't do it. That's the best way to put it. We also have coming up now with some more updates and information, the head chief peacekeeper, and let's welcome once again Dwayne Zacharie.
Good afternoon, Kahnawake. I just wanted to update all of you over the events for the weekend. Right, so on Saturday, peacekeepers were out and about checking into the number of people that were coming into the territory, non-locals that is, and they were able to issue 12 tickets. Right, so those tickets were for non-compliance of the COVID-19 directives. Right, so all of those non-locals were in and about the territory looking for tobacco products. The officers stopped them, intervened, and issued tickets and sent them on their way. Also on Sunday, a non-local male who had just recently traveled from out of province was in the territory looking for tobacco products. He was arrested and he'll be charged in relation to our emergency preparedness law. So I wanted to let the community know these things. At the same time, I wanted to go back to some of the messages I had given to the community before. It's imperative that you follow these directives, right? We're in a dangerous point here in our community. We want to make sure that people are safe and secure. So we need you to follow these directives. We need you to comply. We need you to be smart about the things that you do, right? We're still getting lots of calls for people congregating, lots of people going to parks and being really close together, you know, groups of 10, 15, 20 people coming together. You can't do those things. It's imperative that you do the social distancing. You stay apart from each other, right? I know that people think that they're doing it, but they're not, and we're seeing it. We haven't issued any fines to anyone within the territory yet, but this is my opportunity to warn you that if we do see you congregating, we do see you not respecting social distancing directives, we will start issuing tickets to locals as well. So please, everyone, be safe and listen to the directives. Now,
Yeah, Dwayne, and just a little further to that, there are still people who, despite these daily updates, despite K1037, despite the Eastern Door, Uriwaza, Facebook, Kahnawake Memorial Hospital Center pages, there are still people who are not aware, and it's going to take reminding. We are seeing people following their routines, going to the post office 3 or 4 times a day. And I personally spoke to someone today who was very upset about that. And again, you see people, remind them. And it's really getting hard to believe that some people aren't aware of certain things, but we have to, do everything we can to make sure the information gets out there. Joining us now is Lisa Westaway. She took a day off yesterday, a well-deserved one, but she's back on the program with some updates from the Kahnawake Memorial Hospital Center. Lisa?
Good afternoon. So there's a few things to discuss today. The first is similar to what David mentioned about a change in procedure for ambulance drivers. We have a bit of a change of procedure also at KMHC for all interveners or all healthcare workers that will be working or providing you with care. So I'll explain the reason why there is that change. And in fact, it's the same reason why David Scott received a change in directive today. So on Saturday, the ministry announced that all of Quebec is now considered community transmission. So it's a blanket statement across the board. All of Quebec is considered community transmission. And once that announcement has been made, it brings about changes in practice. So the changes, firstly in practice, are the ones that David mentioned for the ambulance drivers, but for health and social healthcare and social workers, so at KSCS as well, there are changes. So any employee at KMHC or KSCS that is working directly with a patient within 2 meters distance will be wearing a mask. So that's a very big change from what you've been used to before, but that's the change as of today. So starting tomorrow, you'll see that if you do come in for care with a physician, with a nurse, with a social worker, and you are going to be within 2 meters of that person, your healthcare worker will be wearing a mask. So don't be alarmed. It's actually just a protection, and it actually, like David mentioned, it ensures the protection of the patient from the healthcare worker. That's the idea behind it, because the community transmission means that we're not always aware of who might be carrying or who might have the virus or where it may have come from, and so it's better to put these measures in place. So again, these directives come from INSDPQ. You could find this information on the website. It also comes from the Ministry in Public Health, and they very clearly define what type of protective equipment you have to wear depending on the situation that you're in. So this is where the changes come from. I also wanted to talk about the testing site. So we had about 7 people. I don't have the exact number for today. I think we're at 7 people. Yesterday about the same. So our numbers are slowing down a little bit. Now we can interpret that in many different ways. One interpretation could be that everybody from Kahnawake who has symptoms has already been tested within the last week. That could be an interpretation. I'm not sure that that's the right interpretation. That could be one. Another interpretation could be that people who have symptoms are not coming into the testing site. Now, I would guess that that might be a higher or a better interpretation, but who am I to say? I don't really have that information. What I do want to say about it, though, is to encourage you, if you have symptoms, to come and be tested. I've heard some of my wonderful staff that are taking calls and booking appointments have told me that many callers that they get are really quite afraid for their personal information, for their confidentiality. So I just want to explain a little bit again about how all of this testing process works. So when you call, yes, somebody will take your call and they will take your information. So they'll take your name, they'll take your Medicare number, they may ask you what your symptoms are, they may ask you as well if you've had contact with a positive case or if you've traveled. And that information goes into the system and it comes out onto a little not all of those details, but your name and your Medicare number comes out onto a label so that we can label your test once you come in for testing. And then that goes to the testing site. Once the results come in, they do not go back to those workers who took your name and number. They have no idea what the results are. They never see a result. They never get that information. So yes, they have your name when they book your test, but that's the extent of the information that they receive. All of the test results. Now, once the test results come in, they all go to Dr. Gauthier. So we've arranged that every single test result goes to only one physician. If the test result is positive, the result actually goes to public health. So we talked about this last week at some point. Public health contacts every positive case. They will contact you and they'll do a contact assessment with you. They'll work with you to try to figure out during your contagious phase who you may have been in contact with. And then public health will contact all of those people in order to provide them with guidance, support, and instructions about how to self-isolate if that's what's necessary. Public health will also call you if you're positive either every day or every 2 days to ask you how you're doing, to assess your symptoms, to continuously answer your questions and provide you with guidance and support. So that's on the public health side. Dr. Gauthier gets your results on our side, and the only reason for that is so that we can look at a more complete analysis of what's happening in the community. So we're not concerned about individuals' positive or negative results. We're concerned, Dr. Gauthier and I, are concerned with the bigger picture. What's happening in Kahnawake? Okay, Quebec has community transmission, but do we have that here? We don't know yet because we don't have all of the results. We hope to have them within the next couple of days, but we also don't know if everybody with symptoms is being tested. So our interpretation of the results that we have of the 100 tests we've done will be so reliable because we don't necessarily have enough data to be able to give us a full portrait of what we want to see. So I just want to clarify that your results are confidential. Once Dr. Gauthier has seen them, they go to medical archives and they go into your file. And that's the extent of it. So I just want to reassure you in that sense that, that it's not all people that are seeing your results, and it's definitely not the people who are taking your appointments, who you may know in other contexts. It's very complicated having a hospital within your own community. There are pros and there are negatives, and I know that people have that concern about confidentiality, not just in this instance, but on a bigger scale as well. So it's very, very important for us to protect that information at all times, and especially in this particular time. Also, some of the concerns that existed about cars stopping in front of the testing site. There is now a security guard. I think we mentioned that, but just to remind you, there's a security guard ensuring that nobody stops and that cars keep driving. And there's also a privacy guard that was put up. So I've driven by myself on many occasions, and I cannot see the cars that are at the testing site. So I just want to make sure that that's clear. I really urge you to contact us. Many, as I mentioned on Saturday, many of the other testing sites, in fact, all of them are closed to the regular everyday person. So I really hope that if you have symptoms, that you call us and you book an appointment and we test you. And from what I've seen, there are some results that have come back really quickly. Some of the earlier ones are a bit longer, but those that were done even this weekend, we're starting to see some results. Okay, so another thing I wanted to mention, I'm going to use Dr. Gauthier's technique here. I'm going to show you my iPad. And on my iPad, I'm showing you the COVID-19 KMHC website. So on this website, we have placed all of our information about COVID-19, all of the measures that the task force has initiated or put forth. And also at the top of this page, you're going to see what to do. And if we click on what to do, and my email and my internet is working, we're going to see a whole lot of information about respiratory hygiene, about washing hands, about preventing infections. There's a self-care guide that's there as well. And down below, we have information about self-isolation. We daily, on a day-to-day basis, many times per day, get asked for information or precision about what it means to self-isolate. So there are two guides here, one from Canada, one from Quebec. They're both very similar, and they give you all the details of what it means to self-isolate at home. So when do we self-isolate? I'll talk about that first. If you've been given a positive COVID-19 test result, you will be asked to self-isolate. That means that you remain at home, that you do not go to school, work, childcare, daycare, any other public space whatsoever. The only time that you would go to a public place is if it's specifically recommended by your physician. You don't use public transit, you postpone all of your non-urgent medical appointments, you don't invite visitors into your home, you actually stay alone in your room, in your home if you're alone in your home, but if you have other people with you, you actually isolate from those other people. So you stay in your room with your own bathroom, and you have people bring food to you. The whole idea here is that we don't transmit the virus to other people living in your household. And again, public health will explain all of this to you when they call you, but anybody who's had a test done receives this document in its printed form, and it also exists on our website. We also recommend that you clean your space, that it be disinfected on a daily basis. All of those high-touch areas like what we flush the toilet with, door handles, all of our countertops, all of those surfaces that we frequent on a regular basis. Now, do we self-isolate if we've had a positive contact with someone or a contact within 2 meters over 10 minutes with somebody who's considered positive? Yes. So when public health does all of those contact testing with you, they're going to also call all of your contacts, and they're going to recommend or actually oblige you to self-isolate. It's not even a recommendation, it's an obligation. If you've been in contact with a positive case, you will be asked to self-isolate as well. Now, those people who are practicing physical distancing, we also have that on our website. So if we go back to physical distancing, we can print that up, and we have guidelines how to social distance or physical distance in the workplace, because everybody who is in an essential service who is at work should be practicing this within their workplace. And you can also get information about what it means just in general and why it's so important. So yes, you may go for a walk. And you may go for a walk and you may remain within 6 feet of a person that you live with and you're with every day. And remember, this is somebody who does not have a positive COVID-19 result. This is somebody who is just practicing safety measures that we've recommended in order to ensure that if they happen to be in contact with somebody who's positive, that their contact will be at a safe distance to limit the possibility of them getting the virus. So you're actually in your home, you're reducing the spread of germs by your practicing good hand hygiene. You're sneezing into your sleeve. You're avoiding kissing or handshaking. You're disinfecting your high-touch surfaces. you're visiting shops very sparingly. So you're only going out when you absolutely need and only for essential services, because the more you go out, the more you have the chance of contracting the virus without knowing it. So you're actually, and this document, I won't read it all because it's right there. And for those who don't have access, we're going to put some of this into the newspapers on the weekend. But we really urge you to take a look at these documents because they really fully explain the difference between the two elements. So speaking of social distancing, and Lloyd may talk a little bit more about this, but what I wanted to say was really just to hang in there. So we're all, right now, we're at week 4 or beginning week 5. It's extremely difficult. We all are feeling it, each and every one of us. We know that these next 2 weeks are big, big weeks. We know we hear it from Legault every day. We hear it from Trudeau. We know that the next 2 weeks are going to bring us a lot of information and hopefully more details about when we can expect to maybe possibly come out of this. So we're really asking that you just be patient for these 2 weeks. As difficult as it is, as frustrating as it is, the nicer weather is making it harder and harder, but we all have a responsibility to do this together, as difficult as it is. And so I ask that you be patient for the next couple of weeks. And I'm not saying, and I'm not insinuating that in 2 weeks this will all be over, because that would be wishful thinking. But I think the more information that we have, the easier it is to plan and be prepared for what's coming. And I do expect to have more information in the next couple of weeks. So if you need any help with the website, perhaps send in a question to the Kahnawake 911, and we can address those concerns. But the information is there, so I really urge you to go in and look for it. So that's my update for today. Thanks. That's it. I've already washed my hand 20 times, but I'm going to have to do that better after this.
She's not the only one. Here, at the office, at home, anywhere you go. Our final presenter this afternoon is the, what's your title again, Lloyd? Commissioner. The Commissioner of Public Safety. And it is Monday. It was a very busy day in here. There were plenty of announcements, as you've heard already. So it's time for Lloyd to do his daily wrap-up of today's events. Lloyd?
Thank you once again, Joe. And if you don't know my title by now, I don't know if you ever will. Greg Kahnawake, good to be with you once again this afternoon. I have a few things I just want to emphasize and recap for today. Just so you're aware, we did have a Kahnawake COVID-19 task force meeting this afternoon. Again, as usual, it's a good round of discussion. Many different viewpoints on various issues in and around the community. And then we have some discussion, and then at the end of the day, we try to come to a consensus on what is the best way moving forward. Today was largely about just updates and fine tuning what is currently in place, and modifying anything that needs to be clarified moving forward. What we're also in the process of doing, we started last week, but we'll be finishing up this week, is all the directives that were issued by the task force. We're going to be reviewing them, each one, and have a status report on each one of the directives. Is it still is it valid? Is it in compliance? Is there anything that needs to be modified in there? And do a full assessment of each one. That we could go back to the task force and we say there's some areas that need to be modified, need to be tweaked in order to make things either clearer or modify our approach. I think it's a good time where we are right now to do that, not just because of the timeline that we've been involved in here, but also as Lisa mentioned, and I'll underscore that, I think the next 2 weeks is going to be very crucial in terms of deciding where we are, as a community, and also in the larger context, within Quebec, and honestly, probably throughout North America. Because in New York State as well, in New York City, which we know is close to the hearts of many of us, we see what's happening there, and even they're looking at roughly a 2-week period before they can really see what's going to happen on the other side. So this next 2-week period is going to be very crucial with a lot of information coming in, and it's a good time to take a look at all the directives and how they are being implemented and maintained within the community. Regarding that, actually tomorrow afternoon, we're going to start implementing some signs that are within the community, that will be put up in the community, which are going to be clearly state a few things. One, that the highways, there's access for Mercier Bridge only. So basically, if you're on the highways, 132, 138, 207, that fine, you have access to the bridge. But we're asking you just to basically keep on going, because that's what we want to ensure people know that Kahnawake is for residents only. Another one that we have is a sign that is going to be a little bit smaller, but on there it's going to say in there residents only, in French and English, and subject to fines. And this will be put on all the access points off of the 138, 132, and 207 that lead to residential areas. So that will be put up starting tomorrow. We're expecting to have them tomorrow afternoon, and they will be put up as quickly as possible. Again, this is just another measure to inform the outside that we're here protecting our own, and that certainly you're welcome to pass through, but please stay out of our residential areas within the community. We're also going to be maximizing the use of the billboards in the community. We know there's the 3 that are in the community that we're going to be using more time on there to get the message out to the primarily to people who are not from the community on what Kahnawake is doing. So we're going to be utilizing those more as the days go on. We're just working out some of the final details with that, because we don't directly control all the messaging on there, but we're working with Bell Canada on that. So that's going to happen in the next little while. As mentioned on Friday, we're talking about the EXO bus that goes to the community, formerly known as the CITSO bus. Effective today, that bus has stopped its service, so there's no longer going to be a CITSO bus leaving from Agrion, going to the community and back to Agrion until further notice. Hopefully sooner rather than later, but that's, again, we're trying our best to ensure people stay in the community. And obviously Montreal is definitely a hot spot for the COVID virus, and we certainly don't want to see our community members going to Montreal unnecessarily. This is a couple of, I guess, points I wanted to maybe clarify. We had a good discussion on this today with the task force regarding pools. I know I talked about it yesterday. I said about not having your somebody come in to open your pool, and that created some buzz in the community about not being able to open your pool and so on. Just to be clear, what was the intent there? And if it wasn't clear the first time, we're not saying you can't open your pool. What we are saying to the people is, we're trying to minimize outside influences coming to the community. So if you have somebody from one of the local businesses around here from outside the community, we don't want them coming into the community to open your pools. There may be other alternatives for you to do. So that's what we're asking you to do. It's not that you can't open your pool. So maybe that needs to be clarified just a little bit, because we did hear people make some comments on that, because we do listen. We do listen to what's out there, either the COVID task force members, to their various circles, or what's being said on Facebook and such. So we do monitor what's generally happening out there, and we do listen. So we want to make sure that we're clear on that. But also, on the same note, we do listen. And with that said, the issue, for example, using the issue of the pools and the measures being taken there to minimize people coming from outside the community. Because keep in mind, that person, we may know there may be one person or 2 people coming in to open a pool, but we don't know where they've been. We don't know their history. We don't know if they've been, negative or positive or self-isolating or what their history is. At least in Kahnawake, your neighbors kind of have a better idea, what's going on. So that's the primary reason. But if you look at that pool issue and you look at some of the other things that are out there on social media, some people are feeling that the measures that we're taking are too tough, too extreme, and we're going overboard. Whereas other people are saying they're not tough enough. We have to do more. We have to lock down the community. We got to take all these very strong, even stronger measures. So we see this, and we look at the information that's out there. We look at the facts. We see what would be effective and what would not be effective. How do we minimize stress in the community, but at least at the same time trying to be proactive and trying to address the issues, as they arise. We don't want to create unnecessary stress on our community. There's enough stress as there is as we speak right now. So, we look at all the information, and as we always said, and I said last week, we always try to look at this, with a good mind. There's a lot of fear and anxiety, within the community. Believe me, there's a lot of anxiety and frustration, within the task force, because we're trying to gather all this information and make a really concrete decision on behalf of the community. And keeping in mind, sometimes the information that we get, it changes on a daily basis. So some of the stuff that Lisa relayed to you today, about numbers and where we're going in terms of testing facilities and so on, unfortunately, sometimes we don't know what's going to happen in a day or two from now. So that gets very frustrating for us too. So I just want to put that out there for the community, because, to hopefully you could appreciate, the complexity of the issues that we're dealing with in the community, and we're trying our best to navigate our way through. Again, with the primary underscored is the safety of Kahnawake, so we could manage our way through this pandemic with as little negative result as we possibly can, and hopefully, as fast as we possibly can. So, like we said, in 2 weeks from now, we'll probably have, a better idea what's happening. We'll have a good sense of where things are going, and I'll say it again. If we could stand here in a month from now and look back and saying that we have very little cases in the community because we're abiding by directives and we have 0 deaths in the community, I'll be very proud to be the first one to stand up and say everything we're doing today is worth it, and we saved lives in our community, and that's the bottom line. So with that, I'll see you again soon. So ona giveaway.
Yeah, thank you very much, Lloyd, and well put. A nice finish there, and a nice finish for our report today. I know a lot of people get tired of watching the news, but we still have a lot of people, especially in Kahnawake, watching this, watching live, for example, right now. There's quite a few, and then they'll watch it on a replay later on. But it is really such a serious issue when you look, and right now in our in the war room here, we see that on TV, the British Prime Minister, Boris Johnson, is in hospital. He has COVID-19, and he's been moved into the intensive care. So, it's all over the place. We just have to continue to fight the good fight, follow the rules as much as possible, and be patient. So, everybody, take care of yourselves. There will be more announcements coming tomorrow. I know there's lots in the works over the next couple of days. We'll do our best to keep you up to date, right up to the minute here on these COVID-19 Task Force daily updates. On behalf of all of us here, Nyawa Koa, Tano, Onigiwahi.